Hello, I'm Dr. Bernard Kemker,
Hello, and my name is Morgan Green.
and we're the physicians over at Carolina Regional Orthopedics. We're on the adult hip and knee replacement team, and one of the most common questions we get is my knee or my hip replacement going to hurt? And what I can say is yes, I would say knee replacements will hurt you for a while. However, we've had development of several protocols here that have really lowered our pain scores and increased our patient satisfaction scores fairly drastically with the other correlating areas. One of the things that we believe in is called Enhanced Rapid Anesthesia Recovery Pathways, short for ERAS. Morgan is going to talk to you about some of the stuff that she's done with local pharmacies to try to assist you in your recovery after a hip or a knee replacement.
So we have partnered with a local pharmacy to develop a pill pack to have all your medications to make it easier to follow after surgery. This is an example of the pill pack that Thorns has made for us to make it easier for patients to follow and take their pain medicines accordingly after surgery. All the medicines, including your blood thinner, can even be included in this pack after surgery. It decreases the amount of narcotic medication that you'll take, and it also increases the amount of time you'll have to take your narcotics. Dr. Kemker is going to talk about our pain scores after our hip and knee surgeries.
Hip and knee surgeries get graded on a national or regional registry. And what we've done here in partnering with the local pharmacies and patient education through Morgan's preoperative class is really decrease any errors or any confusion after surgery. In doing so, our pain scores have dropped dramatically at the local hospitals to where some of the lowest painful procedures within the state. Additionally, we have some of the lowest narcotic usage. We're very proud of this. We believe in multimodal or many different types of controlling your pain. I think that at Carolina Regional Orthopedics and the surrounding hospitals in the area, you can get a very highly done, less painful total knee and total hip replacement. Additionally, these medication packs have stuff such as your blood thinner, as Dr. Greene already stated, and it helps prevent confusion with you after your surgery and again decrease the risk of complications. If you'd like to talk to us about a hip or knee replacement and its less painful alternatives, we'd be more than happy to evaluate you at Carolina Regional Orthopedics.